Leader of the third party.
Thank you, Honourable Speaker. There are some health experts who are indicating we may see a fifth wave of COVID-19 in early 2022. We've been here before. We see a rise in cases in other jurisdictions. We hear a call from scientists and health experts for stronger proactive measures, and we see little action taken before it's too late. We're not out of this fourth wave, and our hospitals are beyond capacity, our ambulances are backlogged in emergency room waiting bays, and healthcare workers are crying for help to mitigate the number of COVID patients ending up in their wards. Vaccines alone are not getting us out of this. 89.7% of BC's eligible population with a dose of a vaccine is phenomenal, and it has protected millions of people in our province. And yet, our healthcare system is still overwhelmed, surgeries are being cancelled, and burnout is a growing reality for so many healthcare workers. We have been able to see a decline in cases in the past due to strong public health measures that we're moving away from now with full capacity indoors, larger social gatherings, and limited guidance on or investment in air filtration and well-fitting masks. My question, Honourable Speaker, is to the Minister of Health. Are we going to see a more proactive response from this government as we once again see surges in cases in other jurisdictions around the world?
Minister of Health.
Thank you to the member for your question. And British Columbia's response to the COVID-19 pandemic will continue to be guided by the science and by public health leadership on medical issues. Honourable Speaker, all members of the House will know that on July 1st, the province moved to step 3 of our restart plan. We are still at step 3 of that plan. Since then, with the significant success of our vaccination campaign that the member refers to, more than 89% of people over 12 vaccinated. We're very optimistic that children 5 to 11 will be able to join them soon. We've been able to change our approach tactically to deal regionally with outbreaks as they occur and with circumstances as they occur. Such, at the end of July and the beginning of August, we took action in the central Okanagan local health area and in the Interior Health Authority in the middle of August. I'm happy to say that test positivity in Interior Health, for example, has gone from 14.4% at the middle of August to under 6% today. And this allows us, and members have been asking about this, to consider measures that are currently in place in Interior Health as well. We've taken action in the Eastern Fraser Valley as well. We have added a mask mandate in indoor public spaces in the last month. We are moving forward with third doses. Today, about 199 long-term care and assisted living homes have received third doses. We are moving forward with these initiatives and will continue to adapt and respond to COVID-19. It doesn't argue with us. We need to continue to have public health measures and continue to have an even higher rate of vaccination in BC.
Leader of the third party on a supplemental question.
Thank you, Honourable Speaker, and thank you to the Minister for the response. And it's not to say that all these measures aren't effective, but at the same time, if we look at our healthcare system, we can all agree that it is struggling. Nurses are overworked and leaving their profession. Doctors are overburdened and frustrated. When somebody calls an ambulance in this province, and this is such a shock for all of us, we don't know if it's going to arrive or not. People are frustrated trying to get COVID tests. I don't think it's enough to assume that what we are doing will keep cases low. It's not enough to react too late. Everyone who works in healthcare has felt the impact of delayed reactions this last wave and those preceding it. The Provincial Health Officer, the Minister of Health, and the BC CDC have led British Columbia through an unparalleled pandemic for the better part of 2 years. There is no way to be perfect in these circumstances, and there's no undermining of the intentions. There has been incredible hard work and effort, but we can always strive to be better, recognizing the role of aerosol transmission, for example, and how best to mitigate risk with ventilation, filtration, and effective masks. A greater number of health experts, scientists, and doctors helping to give the best available science would not only help inform decision-making, but the collaboration would make our pandemic response stronger.
Member has a question, please.
My question is to the Minister of Health. Will this government start to work with a broader range of scientists and health experts to inform decision-making, recognizing the pressing need to reduce the burden on our healthcare system?
Thank you very much, Honourable Speaker. I thank the member for her question and her comments. And I agree that we seek perfection, but we don't arrive there and all the time. And this has been an extraordinarily challenging period. And I think one of the things that makes Dr. Bonnie Henry a special leader, that makes Dr. Penny Ballem a special leader, is their willingness to work with everybody, to reach out beyond to work with people. And we do that at every level. You should see, Honourable Speaker, how many people from different walks of life Dr. Bonnie Henry meets with regularly to get their advice and to engage with them. Not one-way communication, but two-way communication. So I agree with the member that we have to continue to reach out. We do that every week with scientists and researchers across BC. We provide, I think, the widest range of health information that's been provided on any subject in the history of British Columbia, and we have to keep working together to do that, because the pandemic is, of course, not over, and we have to do things, therefore, and work together to do things that we never consider. I would say this finally, that we had yesterday, I think, 137 people in critical care in BC. 120 of those were amongst the less than 11% of people in BC who are unvaccinated. 120. So what I would say to people is, unfortunately, this wave has been a pandemic of the unvaccinated, and I have nothing but compassion for people, and they are getting the best health care in the world, but we need people to get vaccinated. We need them to get vaccinated now. And with the level of transmission we're seeing amongst the number of people who are unvaccinated, we need to continue to raise those levels. I know people are advocating and working together, including all members of this House, to see that happen. But we have to see it happen, because it is wrong, when it's preventable, for people to be lying in critical care from Dawson Creek in a hospital in Victoria. It is wrong, and we have to work together to see that that changes.